This is Stephanie Tesser recording for PYC 522 Workshop 3.3. The first scenario is Mrs. M. She's a 52-year-old female. She has had depression for the past 3 months and it has been worsening. She has had increased fatigue, which she has not been doing anything or going any places. Her back pain has increased. She is unable to do any dishes because of her pain and fatigue. Her panic attacks are new. During these panic attacks, she has shortness of breath, palpitations, shakiness, sweats occur. This lasts for 5 to 15 minutes and then it resolves and it leaves her exhausted. The patient feels she is still eating as much, but she might not be. She can't tell. Her past medical history: she has depression for 10 years. She has chronic back pain. She had an appendectomy in 1992. She had gestational diabetes and all her sugars are normal. She had a cholecystectomy in 2000. She occasionally has episodes of back pain and takes Ultram for a few days. Medication: she takes Prozac 20 milligrams daily for the depression, and she has changed to Cymbalta lately. She takes Tylenol and Advil as needed for back pain, and she takes a muscle relaxer as needed. She takes over-the-counter Zantac 2 to 3 times a week, and the last Ultram prescription was 3 months ago for 30 pills. She has never been hospitalized for psychiatric reasons or other reasons except for 2 surgeries in childbirth. She is a widow. Her spouse died about 3 years ago. She has 2 daughters that live nearby. She owns her own home, and she was a stay-at-home mom. She used to babysit her grandchild in the morning, but she gets too nervous to do that anymore. She drinks 3 cups of coffee and a Mountain Dew daily. She does not do any street drugs, and she denies regular exercise and does not smoke. Review of systems: she urinates small but frequent amounts. She feels some urgency and is getting worse. She reports losing weight, and her weight was 129 and is now 119. She reports decreased appetite, denies any diarrhea or constipation. She has intermittent indigestion, denies nausea, vomiting, denies chest pain except for during the panic attacks. She has occasional headache relief by Tylenol, denies dizziness, and she is irritable pretty often. Her weight is objective-wise, her weight is 119 pounds. She's 5'3" in height. Temperature is 99.2. She is 94 pulse, respiratory 22, and a blood pressure 128/82. She does appear anxious and she speaks rapidly. She does have a fine tremor noted. ENT-wise is normal. She has slight fullness in the neck. No nodules are palpated. Her lungs are clear. Her heart rate is rapid and regular without a murmur. Her abdomen is soft and non-tender with positive bowel sounds throughout. She has no peripheral edema, and her pedal pulses are 2+ bilaterally. The differentials are depression, anxiety, panic disorder. The number one choice is a panic disorder because of her palpitations. She's anxious, she speaks rapidly, she has the shortness of breath and shakiness and the sweats. Diagnostic wise, because of her palpitations and the sweats and the shakiness and everything, we need to do a full cardiac and respiratory workup to rule out cardiac and respiratory problems, since that could be life-threatening. We also need to complete a history to rule out medical and substance abuse or any related condition, and also make sure that the patient is not suicidal. We also need to do a thyroid profile because of the chest pain and the palpitations, as well as the EKG, tox screen, electrolytes and calcium, and a chest x-ray because of the respiratory issues, that breathing fast and shortness of breath that she has with these panic attacks. I would refer the patient for cognitive behavior therapy. This is very therapeutic, also with medication. we need to find out what milligram her Cymbalta is, because that she didn't tell us, nor did she tell us the frequency. If it is at a certain milligrams, and it doesn't seem to be working, we need to increase the Cymbalta by 30 milligram increments and keep her on that for a week to see if she gets relief. She also, we need to give her a new prescription for Ultram, and she needs to take that regularly and increase her compliance for the back pain. Also needs to take the Tylenol and Advil as needed, and then the muscle relaxer keep taking it as needed for the back pain. Mr. D, the second scenario, is a 59-year-old male complaining of dysphagia. He presented 3 weeks ago complaining of allergies causing a lump of phlegm in his throat. He couldn't shake any of that. He returned in 3 weeks, now having difficulty eating meat, is able to swallow fluids, has to chew each bite forever to get it to go down, and sometimes gets stuck. Past medical history, he has had an EGD 10 years ago and he has recurrent GERD. He has no abnormalities as far as he can recall. He does have frequent GERD. He's also a type 2 diabetic, which is well controlled on metformin. He has hypertension that is well controlled with lisinopril. He has a history of an appendectomy at 14, and he also had multiple gunshot wounds to the abdomen at age 29. He also has benign prostatic hypertrophy. His medication that he takes is Flonase. He takes metformin, as I said, as well as lisinopril, and the Hytrin 2 milligrams at bedtime works well. He also takes over-the-counter Zantac. He used to take Prilosec, but now it is non-formulary in the prison, so he he could purchase it at the commissary, but he has no money, so that's why he had to switch to Zantac. He is frequently incarcerated. He has a significant history of alcohol intake over the past many years, and he has smoked. He's a 45-pack a year smoker. His review of systems, he has lost weight, reports fatigue, has no complaints of nausea, vomiting, diarrhea, constipation. He has GERD that flares up 2 to 3 times a week, and he takes that over-the-counter Zantac for it. Objective-wise, at his last visit, he weighed 168 pounds. This visit, he's 169 pounds, and he's 5'10" in height. His A1C equaled 6.4% 2 months ago, which the blood work showed normal, and his chem panel, including a normal kidney and liver function test, is normal. Today, his temperature is 97.8. His heart rate is 68. His respiratories are 20. His blood pressure is 116/78. Upon physical exam, he's alert. He has no apparent distress. His head, ears, eyes, nose, and throat are unremarkable. His lung sounds are clear to auscultation. His heart rate is regular rate and rhythm with no murmur, rub, or gallop. His abdomen is soft, non-tender. His bowel signs are positive ×4, and he has no peripheral edema, and his pulses are 2+ throughout. The differentials that this could be is like esophageal tumor, esophageal obstruction. Also could be esophageal web, achalasia. A lot of this he rules out, like he has no fever, has no redness of the throat, has no productive cough. The main diagnosis that I feel that it is esophageal tumor because of the dysphagia, because of he feels like he has lost weight even though poundage-wise he has not. It also justifies tumor because of his alcohol and his smoking, along with his long history of GERD that could lead to Barrett's esophagitis also. So the diagnostic test that I would do is a full chemistry panel, liver function test, CBC, iron and ferritin level to rule out webbing. I would also schedule for an EGD that will allow us to see if there's any small tumors, or if that is a tumor, or if it's an abscess or just an obstruction or something. He also needs a chest and abdomen for possible pre-op x-rays, and also a possible CT and a PET scan for staging and get ready for a possible surgical resection. The third scenario is a 36-year-old Hispanic male, Mr. G. His chief complaint is a persistent cough times 3 months, and his history of physical injury, he reports night sweats, also, even though he hasn't taken his temperature, but he has fatigue. His cough is dry most of the time, but when he does cough something up, it is a clear phlegm. He states it might be his allergies, and he has had a stuffy nose, but his cough is not better or worse. His past medical history is he has allergies for years, except no cough. His hypertension is well controlled for lisinopril. He had asthma as a child, and he grew out of it. He has no exposures to contagious illnesses or TB. Medication-wise, he takes lisinopril 20 milligrams daily for the hypertension. Family history, they have hypertension and asthma. His maternal grandmother is diabetes type 2. His mother has migraine headaches. He started a new job 3 months ago. He works in a warehouse with high temperatures and he works a lot of overtime, and he thinks he's tired from it. He does have a history of smoking, which he quit smoking 6 months ago. He did smoke a pack a day since he was 16, which is 20 years. He lives with his girlfriend and her 2 kids, and they have 1 child together. He is from Texas, but he was born and raised in Mexico. He has no complaints of chest pain. He denies wheezing, occasional shortness of breath with exertion, and he denies any nausea, vomiting, diarrhea, constipation, or heartburn. Objective-wise, his weight is 180, his height is 5'11", his vital signs, his temp is 99.2, heart rate 72, respiratory 18, and blood pressure 134/84. His nasal turbinates are gray and boggy. His pharynx is injected with clear postnasal drainage. He has no sinus tenderness and no lymphadenopathy. His lung sounds are clear. Heart is regular without murmur, rub, or gallop. His abdomen is soft and no peripheral edema. His differentials that I've picked: infectious process, possibly, viral definitely, or possibly bacterial. Could have a smoker's cough because of all those years that he coughed. Could be allergic rhinitis, asthma, sinusitis. His lung sounds are clear, so I ruled out the asthma. Smoker's cough, he's really not coughing anything up. I'm still curious about the infectious process, like viral, because he does have a low-grade temp at 99.2. But I'm leaning towards my number 1 diagnosis is allergic rhinitis, because his nasal terminates are gray and boggy. He has clear and postnasal drainage, and he has no sinus tenderness. The test that would be done is a medical history to find out the culprit of allergy, and then what is making his allergies worse and everything, and then also maybe allergy skin testing. Prescription or treatment-wise, maintain an allergy-free home, get an air humidifier, use air conditioning, and also order fluticasone 1 spray each nostril twice a day, and do that religiously. Once that builds up in the system, it will help long term. And also add Zyrtec 10 milligrams PO daily at bedtime as needed, in case he still has excess drainage or anything like that. Thank you for your time.